Hi, my name is Emily Downs, and this is your hot tip for the day. We're going to talk about optimizing color Doppler and pulse wave Doppler. So today we're going to use the carotid artery as an example to optimize our images. We want to work through things systematically, starting with 2D. So make sure your gain is optimized, in this case turning the gain down. We also want to adjust our depth so that our organ of interest, in this case the carotid, is in the middle of the screen. Also, your focal zone should be at the level of the area of interest or slightly below. Next, we're going to activate color Doppler. Make sure when you turn on color Doppler that your color box is steered the correct direction with the angle of the vessel. So if it's this way, you want to correct it so that it is running with the vessel. We can also see in this image there's an ultrasound artifact called aliasing. By increasing the scale, or PRF, we're going to get rid of that artifact and the velocity will match the velocity of the vessel. Now that we've optimized color Doppler, we're going to activate pulse wave Doppler and place it in the middle of the lumen of the vessel. Make sure that your angle correct is in line and parallel with the vessel walls. After activating pulse wave Doppler, you want to ensure that your waveform is in the middle of your tracing and that you are not missing any information. In this case, you want to optimize this pulse wave Doppler by increasing your PRF, or pulse repetition frequency, to decrease the size of your pulse wave Doppler. This allows for easier interpretation and a more accurate velocity measurement. And here we can measure the peak systolic velocity, which gives us 120 centimeters a second. And that's your hot tip for the day. Now you try it.